Hi, I'm Campbell Hutton, Vice President of Regulatory and Health Policy at JDRF, and I'm really pleased to be here today with Dr. Justin Gregory, a pediatric endocrinologist at Vanderbilt University Medical Center. Thanks so much, Justin, for being with us today.
A pleasure.
Dr. Gregory had a chance earlier today to talk to CDC's vaccine committee about prioritization of people with type 1 diabetes for the COVID-19 vaccines. And this is based on Dr. Gregory's research that he and his colleagues have been doing at Vanderbilt. So Dr. Gregory, I would love it if you could share with us a little bit about your research.
I'm happy to do that. If we rewind back maybe a year ago, we were just starting to find out that COVID-19 was not only coming to the United States, but it was coming to stay. It was evident that it was spreading in the community in the Seattle area. And at that point, we already knew that COVID-19 was really bad for causing severe illness in patients with type 2 diabetes. But way back then, in that early phase in the virus spreading in the United States, we didn't know anything about what it did in people who have type 1 diabetes. And so as I live in Nashville, Tennessee, and in March, we had our first case of COVID-19 in our local community. And so at that point, I just had a real burden to see, okay, is this virus just as bad in type 1 diabetes as it apparently is in type 2 diabetes? And so what we did here, myself and many of my colleagues at Vanderbilt, even some colleagues at the University of California, San Diego, about half of our team have type 1 diabetes themselves. And we designed a study. It's called a prospective cohort study. But all that means is that you say, okay, I'm going to start looking for people to get COVID-19, and then I'm going to follow them for 2 weeks to see how sick they get. That's all a prospective cohort study does. And then you compare different groups. And so what we wanted to see was whether or not people with type 1 diabetes were more likely to get really sick from COVID-19 than people who didn't have diabetes at all. And we were also looking to see how sick people with type 2 diabetes would get from COVID-19 compared to people who didn't have diabetes at all. That first story was that people with type 1 diabetes have about a 3.5-fold higher risk of coming into the hospital from COVID-19 compared to people who don't have diabetes at all. And so it's, I guess said more simply, if you have type 1 and you have COVID-19, you're 3.5 times more likely to come into the hospital than if you don't have diabetes at all. And that risk was very similar to what we saw in patients with type 2 diabetes. The more patients we get, we find that yes, that risk is about the same the more patients we get. And so the practical application of that was really what we did today, which is we presented that information to the CDC Immunization Committee to say, we already know people with type 2 diabetes are considered high priority for immunization, and we agree with that. But this current CDC guidance does not include type 1 diabetes as a condition where patients are at increased risk. The language is people with type 1 diabetes might be at increased risk. And really our purpose today was to go to them and say, hey, you need to look at our data from the study that we did. I also talked about some data that was gathered in the United Kingdom to really make the case that people with type 1 diabetes should be prioritized as a condition that does increase risk for severe COVID-19.
Wow, that is such an important message that you shared with the CDC committee today, and really such important research and data that you and your team have gathered so that we can do everything that we can to help keep the type 1 community safe. So thank you so much for your work. And JDRF has been, because of the importance of this issue and this evidence, we've been sharing your data and publications with decision makers at the CDC. We've submitted our own comment letters to the CDC committee who you spoke with today. We have been able to directly speak with some CDC staff and share this data, which is important. And additionally, as you mentioned, the CDC is putting out guidelines, but it's really the states who are putting into practice the distribution of the vaccines. So the states are an important partner in this as well. And because of that, we've developed resources that individuals can use if they want to communicate at a local and state level with decision makers there. So resources that include information about your important research. You know, and it's maybe important to point out that the CDC guidelines came out, the original ones came out in December. Your research was published in December. So the CDC guidelines that are currently on their website didn't consider your evidence. And so, you know, that really underscores the importance of what you were able to share today. So could you just talk a little bit about that and kind of the underscoring the message that you sent to the committee and how you hope that this will change their recommendations?
Absolutely. I think the people that my colleagues on the CDC are professionals. They're very well intentioned, and sometimes policy lags behind the data. And so part of what we're trying to do as a partnership as scientists, physicians, and advocates is we're trying to narrow that gap between policy and the data. And so that's exactly what I did. In those presentations, you have 3 minutes. And I said, I want to get across 2 main points. The first main point we've talked about a little bit, which is that you have increased risk of being hospitalized, of getting really sick from COVID-19. My colleagues in the United Kingdom have found the risk of mortality, of dying, is higher in patients with type 1 diabetes. I want to make a note on that, though. My colleagues in the United Kingdom found that mortality was only seen in patients older than age 40. So I want people to understand that about the mortality data. But nonetheless, there's this increased relative risk. There's this increased risk of, if you have type 1 diabetes, of getting really sick from COVID-19. So I wanted to make them aware of that. I cited some specific studies to them so they can look at the studies themselves and see the data themselves. And so while the risk is increased, the benefit of the vaccine is also very high for people who have type 1 diabetes. And so the second case that I made was that this vaccine is highly efficacious. And the randomized control trials that were done to get FDA approval for the 2 currently approved vaccines were done very well. And one of the things that was done very well was that they were very deliberate in recruiting people with diabetes into their study. 9% of the participants had diabetes. And this is an important point. People with diabetes in the study were just as likely to derive benefit from the vaccine as the whole study itself. So in the study, we found that the efficacy of the vaccine was approximately 95%. That same number was what we found in terms of efficacy for people with diabetes. So the risk is high, but the benefit is also great. So when you put those 2 things together, I think it really makes a case to say we need to prioritize people with type 1 diabetes because we can maximize the benefit of this vaccine. And so that was the central message that I tried to get across in 3 minutes.
Well, you did a great job, and it's such an important message. You know, all of us at JDRF certainly agree wholeheartedly that based on the evidence, people with type 1 should be prioritized in the same way that people with type 2 are prioritized to receive the COVID vaccines. And I think, you know, with everything that the community is doing, you're delivering this message to the committee today. I think, you know, once they review all of the evidence that's available, it seems like, you know, hopefully the CDC will come to the same conclusion. And in the meantime, JDRF is monitoring and actively pursuing this very, very closely. This is a really fast-moving and fluid situation. As I mentioned, we have resources on our website that everybody should go to. It's a lot of information about the vaccines, details the data that Dr. Gregory has explained, and gives people resources and information should they want to communicate at their local level. We're keeping all of these resources really updated since this is so fast moving, so continue to check out the webpage. It's jdrf.org/COVID vaccines is where you can find it. And we, like I said, we'll be keeping that really updated. So Dr. Gregory, thank you so much for all your work you're doing, the amazing research that's really helping to illuminate things for our community in this pandemic. Thank you for speaking today to the CDC committee and for giving us kind of an inside look at that and what your message was to them.
Well, it's my pleasure, and let me also thank the JDRF here for their advocacy in this area. I am grateful for the JDRF, which has supported the research that I do as a physician scientist. I remember when I was diagnosed 20 years ago in February with type 1 diabetes myself, I didn't know the first thing about type 1 diabetes. And the JDRF was the first place we went to. We did our first walk a few months later. JDRF has been a part of my own personal journey with type 1 diabetes. And I'm so grateful for this organization. Thank you and for all the work that you do also.